Hello friends, welcome to Knowledge Bytes. Friends, today I am going to teach you an important topic and that topic is Achalasia Cardia. This topic is from the Harrison. So Achalasia Cardia is the disease of esophagus. I will tell you what is the meaning of Achalasia and Cardia later on. But before that, I want to tell you how the normal peristalsis occur and how the food enter into the stomach. This is esophagus and this is stomach. Suppose the food particle is present here. Just above the food particle, contraction occur, and just below the food particle, relaxation occur. If synchronized contraction and relaxation occurs, that lead to normal peristalsis. So the first reason for which the food particle enter into the stomach from esophagus is peristalsis, and the second reason is due to gravity. Now which particle will enter first in the stomach? Food and water both enter into the stomach in same time, and also gas is present in the fundus of the stomach in normal esophagus. But if there is some deformity in the esophagus, then what will happen? We are talking about the deformity which is happening in the Achalasia Cardia. In Achalasia Cardia, ganglionic cell. This ganglionic cell which is present in the matrix plexus of gastrointestinal tract, but we are concerned with the esophagus. So the ganglionic cell which is present in the matrix plexus of esophagus, its function is two things. First is the contraction of esophagus, and second function is the relaxation of esophagus. Contraction is due to excitatory neurotransmitter, that is acetylcholine, and relaxation is due to nitrous oxide or vasoactive intestinal peptide. Now if somehow this ganglionic cell gets damaged, then what will happen? But before that, how this ganglionic cell gets damaged? This ganglionic cell damage because of autoimmunity. This autoimmunity is attributed due to latent infection which is caused by human herpes simplex virus 1, varicella zoster virus, and trypanosoma cruzi. One thing more, Achalasia Cardia is very uncommon disease. Why Achalasia Cardia is very uncommon disease? Because person should be genetically susceptible. The person should be genetically susceptible to these three infection, and these three infection will lead to autoimmunity, and this autoimmunity will lead to ganglionic cell damage. I think I am clear to all of you. Now what will happen if this ganglionic cell gets damaged? When this ganglionic cell gets damaged, contraction will not occur, relaxation will not occur, and when proper contraction and relaxation does not occur, then proper peristalsis will not occur, or no peristalsis will occur. For that, the food particle will take more time to reach into the stomach, and because of infection of these three ganglionic cells are getting damaged, then we can see two things. First thing, we will see the esophagus dilation. Since contraction relaxation is not occurring, then esophagus dilation will be seen there, plus there will be hypertrophy of lower esophageal sphincter. Now I am showing you how the case is seen, how esophagus is seen. So there is hypertrophy of lower esophageal sphincter and dilation of the esophagus. Now this food particle has to enter into the stomach. Now this food particle will take more time to reach into the stomach. Food will take more time, liquid will also take more time. But as compared to normal esophagus, food will enter first and later liquid will enter. Why? Because of gravity. Also, since the tone of lower esophageal sphincter is very much high, the gas will be absent from the stomach, but gas is present when esophagus is normal. There is no increase in tone of the muscles of the esophagus. I think I am clear to all of you. Now we will see the clinical feature. So we can see two types of clinical feature, in early phase and in late phase. In early phase, the clinical features shown are dysphagia, difficulty in eating, regurgitation. This regurgitation is due to retained food, fluid and secretion in the esophagus. Chest pain will be there, and since the person is not able to eat, then that person will have weight loss. Now I am going to tell you what is the meaning of achalasia and what is the meaning of cardia. The meaning of achalasia is there is loss of ganglionic cell within esophageal myntrid plexus. I have told you that myntrid plexus is present in ganglionic cell is present in myntrid plexus, and myntrid plexus is present in all of the GIT, but we are concerned only with the esophagus. And achalasia means there is loss of ganglionic cell within myntrid plexus of esophagus. And here the cardia means you can see that the patient is having chest pain, that is the retrosternal pain is happening to the patient, so therefore the term achalasia cardia is given. So now we have seen the clinical feature of early achalasia, and now we will see in late phase. We have seen the clinical feature in early phase, and now we will see the clinical feature in late phase. In late phase we will see the early phase symptom, plus we will see that the patient will have bronchitis, aspiration, pneumonia and lung abscess. All these are the complication. One more complication we will see later on. The late phase is occurring because of chronic achalasia. The patient will give the history that he is having squeezing pressure like retrosternal pain, squeezing pressure like retrosternal pain, and which is radiating to the jaw, neck, arm and to the back. Now we have to investigate the patient. Investigation. Firstly we will do the investigation, which is barium swallowing. Barium swallow. In barium swallow, a patient is given to drink the barium, and because of that the esophagus takes the contrast, and when we take the X-ray, then the X-ray shows bird beak appearance. Bird beak appearance will be seen in the X-ray, and the investigation of choice is endoscopy. Not only endoscopy, plus high resolution manometry. The function of manometry is it tells the pressure, it measures the pressure, and when there is the hypertrophy of lower esophageal sphincter and the tone of lower esophageal sphincter is high, then the pressure is also high. The endoscopy and manometry is the investigation of choice, since it tells It gives the early diagnosis before esophageal dilation and food retention. Now we will see the treatment part. Treatment, we are giving the medical management. The medical management which we are giving nitrous oxide. This nitrous oxide is a inhibitory neurotransmitter, and this inhibitory neurotransmitter will decrease the tone of the lower esophageal sphincter. We are also giving calcium channel blocker. But these two drugs is only given when the patient BP is normal. We can also give botulinum toxin. This botulinum toxin is given via endoscopy. It is injected in lower esophageal sphincter under the guidance of endoscopy. Okay, the botulinum toxin inhibit the release of acetylcholine from the nerve ending. It is good for patients since it gives relief up to 6 months. What is the only durable therapy of achalasia? The only durable therapy of achalasia are two. One is the pneumatic dilation. We keep the balloon in the lower esophageal sphincter, which helps in dilation of the lower esophageal sphincter. But the treatment of choice is Haller's myotomy. And we cut the esophagus up to the aortic arch. When the patient is having serious weight loss, then we cut the esophagus up till the aortic arch. Now we have completed the Achalasia Cardia, but lastly I have told you we will see one complication in last stage. That is, one last complication is cancer. This cancer is due to the food particles which is present in the esophagus irritates the squamous cell of the esophagus. Because of that, the cancer which occurs is the squamous cell carcinoma. One thing more I want to tell you, that in lower part of the esophagus adenocarcinoma occurs, but in this case in Achalasia cardia squamous carcinoma is occurring. Why not adenocarcinoma is occurring? Adenocarcinoma occurs in reflux esophagitis, when the acid from the stomach enters into the esophagus. But since the tone of the lower esophageal sphincter is very much high, because of that the acid does not enter into the esophagus. The cancer is happening because of the irritation of the mucosa, because of the food particles which is present in the esophagus. So therefore here squamous cell carcinoma is occurring. I think I am clear to you, and now we finish the Achalasia cardia.